I'll be talking about the age-related changes of bones and joints. I'll start by presenting a case study of a patient experiencing these changes and then expand on some common processes seen in older adults. So why are we talking about this? It's important to address bone and joint changes because while they're not associated with life or death, they can make simple tasks harder and decrease a patient's independence. This can lead to a failure to thrive characterized by depression and lower self-esteem. As nurses, we must fully understand bone and joint changes to give proper empathy and to help patients make lifestyle modifications that allow independence and promote a higher quality of life. On to our patient. Our patient is Doris Jensen, who is a 74-year-old woman admitted to the medical surgical unit for a fall and right ulnar fracture. Her husband passed away 4 months ago, and she now lives alone in a house. She has a daughter who lives 30 minutes away and who visits 1 to 2 times per week. When asked about past medical conditions, Doris said she hadn't been to the doctor since she was 60 years old, when she went to figure out why she was gaining weight and having hot flashes. The doctor told her that she was going through menopause, but Doris doesn't remember anything he said about this process. Since Doris hasn't been to the doctor in so long, she will need a thorough assessment to determine any other health issues. Education must also be provided about body changes that occur after menopause to promote health and safety. In general, when assessing the bones and joints, there are a few key steps to gathering adequate information. First, visually observe the joints. Look for obvious deformities and nodules. Next, palpate the joints to detect signs of inflammation like swelling and heat. Ask the patient if they've been experiencing pain or physical limitations when moving their joints. When the patient is standing, observe the spine and note abnormal curvature. Ask the patient if they've been experiencing joint or bone pain and if they have had any falls or fractures recently, and if they have, identify the risk factors. Lastly, assess the patient's nutritional status to determine any deficiencies. In all aspects of the assessment, try to determine if the patient's physical status has changed, as this will help identifying age-related bone and joint progression. So back to the case study, talking about Doris again. Due to her age and recent fracture, a thorough assessment of Doris's musculoskeletal system should be attained to evaluate her ability to thrive. So doing this, I followed Maslow's hierarchy to guide this process. Physical changes are the most important and require the most attention. Doris has Buchard knots, which indicates osteoarthritis. When standing, she is noticeably hunched over and stands at 5 foot 2 inches, although she was 5 foot 5 inches during her youth. She was asked to squeeze the nurse's hands as hard as possible, but could not do so without joint pain. Due to her recent fracture, a bone density test was ordered to assess the presence of osteoporosis. The test determined that she is positive for this disease. Lastly, when asked to bend and touch her toes, she could barely bend over at all, indicating highly reduced flexibility. As for safety, Doris has a history of 2 falls, including the most recent one. She states that she often skips meals due to the pain cooking brings her hands. She lives alone and cares for herself, although her daughter does visit to check up on her. Doris stated that her self-esteem has decreased because she feels too weak to do anything. She said she used to work out daily and is having a hard time living a sedentary life. It is determined that she is not experiencing self-actualization due to her physical limitations. Education. So education should involve specific problems the patient has or is at risk for. The focus should be on safety and promoting quality of life. Using Doris's situation, I will give 5 examples of helpful education. 4 things that are important for her to hear, and then 1 thing that specifically is important for her family members to hear. Because as one ages, they do rely on more help from their family members, so including them in any education is important. Managing any disease process is a priority. So number 1, Doris has osteoarthritis and should be taught to go on several walks a day, lose weight, and use NSAIDs to reduce pain and strengthen her joints. As bones weaken, the risk of falls and fractures increases. Doris should be educated on the danger of falls and the importance of increased caution. She should also be led through stretching exercises to promote flexibility and reduce fall risk. Finally, she should be educated on the necessary environmental modifications such as removing rugs, ensuring proper lighting, and cleaning floors. To promote healthy bones and joints, Doris should be educated to consume foods high in calcium, such as milk, green leafy vegetables, and cheese to help bone formation. Since Doris mentioned not eating due to the pain cooking causes her fingers, she should be educated on additional means of finding food, such as pre-made meals and having her daughter bring food. Lastly, bone and joint deterioration has caused a loss of independence. To combat this, Doris should be educated on how doing all of these things mentioned before will improve her quality of life and allow more independence. As for her family members, they should also be educated on how to support her age-related bone and joint changes. They should be taught to allow her to do as much as possible and to allow more time for simple tasks. Doing so will allow independence and potentially help her achieve self-actualization. They should also be taught to allow her to do as much as possible and to allow more time for even simple tasks. Also, regular doctor visits should be scheduled to properly follow the changing state of her bones and joints. Lastly, family members should also be educated on what environmental modifications should be made so they can help make them. Doris's problems can be traced back to 3 common bone and joint changes that occur with aging: reduced bone density, curved spine/height loss, and joint stiffening/hardening. These are common findings in the elderly. I will now explain how and why these processes occur. Brittle, frail bones are often seen in older patients with reduced bone mass. When a woman experiences menopause, her estrogen levels decrease, so the osteoblasts aren't able to effectively produce bone matter. Soon, bone breakdown exceeds bone building. The same thing occurs in men as they age and produce less testosterone. As more bone is reabsorbed and created, the amount of calcium and phosphate decreases, which changes the mineral composition of the bones. These minerals make the bones strong, so when their levels decrease, the bones become more susceptible to fractures. As one ages, it is common for them to become less active. Weight-bearing activity causes new tissue to form. If an older adult becomes inactive, their body will not be as stimulated to produce bone. All of these factors combine and may result in microfracture accumulation, which makes the older adult's bones even more frail. Another common process that we talked about before is curved spine and height loss. This occurs due to a chain of events. The natural effects of gravity over time reduce the space between the vertebrae. This typically can't be prevented because it's a natural process. Additionally, older adults are often dehydrated, which reduces the amount of water in the spinal discs and make it hard for the vertebrae to support the body's weight. These 2 events combine together and cause the vertebrae to become thinner and closer together. The result of this is vertebral compression, often seen as height loss. When the disc can't support the weight of the body, the spine becomes a hunch and can even cause kyphosis, which is the excessive curving of the spine. Lastly, we have age-related joint changes. Joint pain and tenderness is a common occurrence in older adults. In a healthy person, the joints are protected by cartilage and synovial fluid. Both act as a barrier to prevent the bones from colliding. Many of the joint changes related to aging are caused by the inactive lifestyle often associated with older adults. Movement of the joints and the associated stress of movement keeps the synovial fluid moving in a normal person. However, the lack of activity leads to a decrease in fluid production and causes the shrinking and stiffening of cartilage. Additionally, normal wear and tear of using cartilage over the years decreases it. When the normal cushion between joints is reduced, bones begin to rub together, leading to stiffness and pain. If this progresses far enough, it'll be categorized as osteoarthritis. So in the picture here, we have the knee, and that's a common place of osteoarthritis. Additionally, the fingers are often seen experiencing this, and that can really interfere with things with like cooking, as we saw in the case study with Doris, but also writing and simple things. And essentially, joint changes just make life a little bit difficult for the patients, and this leads to the decrease of independence. Thank you for listening and watching. I hope you learned a lot about the aging process effects of bones and joints. Hopefully, if you're ever in the hospital and experience a patient with these changes, you'll be able to be empathetic and learn from that, as well as help them make any lifestyle modifications that can help with the process. Thanks for watching.